We know that one of the hardest parts is taking the first step, empowering yourself to take that first step. So when you do decide to take the first step, many facilities, you will call a number. They will ask you what you're looking for. What services are you seeking out? So empowering yourself to know what those services are. They'll ask you insurance questions, demographic questions, and exactly what brought you in. Like, why did you decide to seek our help?
Maybe a fear of seeking mental health care could be somebody's going to tell me something I have to do or make me do something, but it sounds like at the beginning especially, it's very much like, what are you interested in? What are your challenges? What are your concerns?
Yeah, it's very, why did you decide to start this process? We really want to know why, what brought you in? Like, why did you come to us for help?
You already talked a little bit about the intake questions. What are some other things people might expect at a first appointment?
So when you first come in, we try to make it warm and welcoming. It's just like going to a doctor's office. You'll check in and there'll be some paperwork and you'll be brought back, meet with a therapist. And so the first session is really a get to know you session to figure out what's going on. And then we try to meet the person where they're at, make them comfortable, get to know them. So it's not just a person writing on a notepad the whole time. So it's more of a relationship building process.
Right. Do you find that some people feel issues of judgment or stigma coming in, and what do you guys do about that, or are they concerns?
Yeah, I really try to normalize and help them recognize a lot of people are facing what you're facing. There's no shame in getting help. We're not going to judge you. We're not going to, look down on you. We're just going to walk alongside with you.
What about people who don't feel like they're saying, oh, well, I'm not really depressed. I don't feel, like I have issues with being bipolar. If somebody doesn't have something they feel is very specific, can they still seek treatment?
I would say if they've made the first step to come in, there's something that needs addressed. They may not always agree with maybe the diagnosis, but I think the longer that the relationship goes between a patient and a therapist or their skills coach, the more trust is built, and maybe they can start to help them understand that maybe it really is what they're suffering from are signs of depression or signs of anxiety or bipolar disorder. Like Bethany mentioned earlier, that's not the label. You aren't bipolar. You have bipolar disorder. You aren't just depressed. You have depression. So
Changing the language.
That's something that we've worked a lot on, especially when it comes to substance use. We don't use words like you had a dirty screen, you had a positive drug screen. You're not an addict. You have substance use issues. So it is changing. The wording and the verbiage has really helped normalize these issues.
It is interesting to me just to hear the level of individuality that gets brought into it, that you can think, it's not as if you come in, here's your answer, but it's like you talked about, Bethany, walking through the process with somebody or walking alongside to kind of figure out who someone is as a person and what issues are presenting.
And I think also we have to remember it is a voluntary situation. So if someone does not agree, then that is their prerogative. We take the information given, we make an appropriate diagnostic impression, and we recommend certain services. We cannot force anyone to participate in those services or can even follow through after that initial appointment. But it's just like if you were to go to your family physician and they prescribe a medication, they can't follow you out the door and make sure you take that prescription. So it's just understanding that the clinician is the expert. You came there for a reason. And here's what they suggest, this is what they recommend, and hopefully that we've done our part to educate them on how it could benefit them, and that will encourage them to keep pursuing it.
Right.
When you come up to the front where we have our patient services area, knowing that when you talk to them, they are not judging you from the moment you walk in. You come up to the front, they greet you with, Right now it's eyes smile, but we still have masks on, so
Just have
it's
to
still
take
a
the word
smile.
for
You
it.
can see the cheekbones. And we're happy that you came in. We're happy that you're there, and we're happy that you're seeking treatment. And it's completely judgment-free. And when you come in, all the questions that we're asking are the same questions we ask everybody. So it's not specialized to, you walked in with a substance use, you came in for substance use, so we're treating you like a substance use patient. It's not like that. It is, we're treating everybody exactly the same as you walk into the door. All the questions are the same, so it feels very calming coming in.
And I think from the first experience, and that's why we do want to offer such a warm and inviting, patient service experience, because that's first impression. And from there on, we want to, positively reinforce that they made the right decision and they did a good thing by taking that leap and, seeking treatment.
I think I was going to ask a little bit about what kind of qualifies people to do certain roles within the provider. People might be thrown off by all the different abbreviations at the end of a therapist's name. What do you recommend for getting over that hump and thinking, well, I don't know what each of these means? Could you help us at all with that?
Yeah, so at most community mental health centers, they offer therapy and skills education and medication management. In order to be a therapist, you have to have a master's level degree. Some have gone farther than that and gotten to be licensed clinicians. And those that provide our community-based skills education, they either have an associate's degree or a bachelor's degree. And then our nurse practitioners and doctors that provide our medication management, obviously, doctors and nurse practitioners, and doctoral HSPPs have doctorate degrees. Mm-hmm. Yeah.
People wonder how to pay for it. Could you guys talk a little bit about that as far as what are the challenges or accessibility of insurance and paying for services at this point?
When it comes to insurance, many people do come in with insurance, and they can have commercial insurance, Medicaid, Medicare. We accept all of them. We also accept employee assistant plans, student assistant plans. And if you don't have any insurance and we're trying to figure out how to help you pay for those services, we have a sliding fee scale that goes by income based. We will get with you and figure out if we need to help you get a private insurance or if we need to help you get Medicaid. We will move through that process with you.
It goes along with what sounds like the theme here, is that just walking beside people and kind of helping along how to figure out how to navigate the whole.
We don't want the extra anxiety of trying to pay for the service.
Right.
We need to make sure that we help anybody find the way for payment.
Right.
There's always something that we can do to help.
Well, I think there's a lot of things that are out of our control, but if we are able to assist somebody, like if they come and say, I don't work, I don't have any income, but I need help with my depression. Someone like Mary who's a navigator is going to help them work with them. What are you eligible for?
Uh-huh.
Next thing you know, they could be fully covered with Medicaid. So not only are they covered for mental health, they can now go to that emergency room for, any, medical needs. So
They can now go see they can see an eye doctor. They can now go see their dentist.
Right.
Because when all they had to do was walk through the door.
and they didn't
we
realize they
both-
were eligible.
Right. So, if you're already struggling with stuff, finding extra steps to figure out, navigate all the insurance and all of different qualifications.
If they aren't well informed about mental health services, they're going to base it on what they see on TV. It's a therapist sitting there with a notepad, and that's $75 an hour, or this is $300 an hour, and most people are like, well, I can't afford that. So they don't even take the time to pursue and look into it, because they're just assuming that's what it is, when in fact it is a lot easier and accessible.
Does it seem to you all that pop culture reflections of psychology or psychotherapy are accurate, or somewhat accurate, or not accurate, or what do you think as far as that as a reflection of the reality right now?
Definitely not accurate. So in the movies, you'll see the therapist nodding, writing, but that's not the case. If it's a kid, we're on the floor with them playing. We are doing activities. We're very engaged in meeting the person where they're at. And we definitely don't view our patients as crazy or anything like that that's kind of portrayed in the movies.
Or they're not laying on the couch, and they're not going, well, our time is up. If it's in the middle of session and, we're not gonna just cut them off,
Yeah.
So, yeah, I think pop culture exaggerates a little bit.
It's definitely not that. "Well, how does that make you feel? How does
Yeah.
that make you feel?" Each question, each response, it's tailored to that person. It's not just a script that therapists follow.
It sounds a lot more authentically relational.
Well, I think Bethany said it earlier, it's like we meet them where they're at, and if it is a 4-year-old who wants to play and that's how they communicate, yeah, she's gonna get on the floor and she's gonna engage with them that way.
Kind of last question for this session. If somebody has no idea how to jump into this area, if you have no idea how to pursue mental health care, where do you start? What do you start looking up?
I would start, if you have access to the internet, do a Google search for what is available in your area. If the internet is not an option, you could text or call 211 and you tell them exactly what they need and they will give a list of all available resources, in that area.
Or you could reach out to any of your resources you already have. You can talk to the school. The YMCA is a good one. You can talk to your doctor's office. You can go to your doctor's office and they will refer you over. Going to any of those will help you connect.
Well, thank you guys so much for your expertise again in this area and sharing with us how to explore this aspect of life. And I really appreciate again you guys talking about therapy and mental health care.
Thanks for having us.
Thank you.
Thank you.